Good morning, students. Welcome back. So here we are going to discuss about OET exam review for 1st June 2024. You will get a clear picture regarding the examination, starting with the reading module. First set, it was about pediatric surgery. Paragraph A includes patient selection criteria. Paragraph B with supplements. Paragraph C with the medication, pharmacokinetics. Paragraph D with complications and side effects. It's related to the first set of reading. So I hope you all attended well, those who got the paper. C1, C2 includes marking and sharp injuries about the writer's opinion and all. Now, regarding part A of second set about Parkinson's disease, paragraph A includes etiology and risk elements. Paragraph B, medicines. It was in a table format. Paragraph C, preventive medicine and applications. Paragraph D, about signs and symptoms, including diagnostic evaluation. I hope you are clear about that. And coming towards the C1, C2 for that, about different medicines used for various diseases. It was like a research study and about the visiting hours in C2. Now, about the third set, about fracture. Paragraph A includes the type and investigations. Paragraph B, complications. Paragraph C, splint and traction method. Paragraph D, about the treatment and medications. So that's about the entire reading. And about that C1 and C2, it was about snake bite and placebo effect. Now we are moving towards the next module, writing. In set 1, it was a transfer letter, hospital to temporary care facility, and the case unknown, purpose for the continuous monitoring and observation, case epistasis, which means nose bleeding and result in anemia, while assessment hypotension, patient was 80/50 and patient reported fainting and fall down once, so vitamin supplement and a dietitian consultation was included. So you need to write a transfer letter. Now regarding the set 2, letter to patient's doctor, the patient is coming to the emergency department. Patient has a second degree of burns, includes neck and arm. Admitted the patient to the ward. The next day, the patient complained about the painful urination and done urine test and diagnosed with UTI. Treatment started. Patient's condition is better, but patient is agitated in a moderate level, so the doctor was concerned about early stage of dementia. So need to report all these to the patient doctor for further assessment and management. So you need to write a letter to the patient doctor. Now coming towards the next module, speaking. So the first role play card about the situation was hospital ward. It's about chest tube drain removal. We need to explain the procedure to the patient, the reason for the removal, the post procedure, the care, what all are the things they want to consider. So we need to reassure the patient. Now regarding the second role play card, it's the setting was local clinic, the patient with fever, assessment, management, and the demand. We need to explain everything in detail. Third card, the setting was hospital ward, patient with congestive heart failure, leg and ankle edema. The nurse need to ask for the permission for the clinical assessment. So the doctor suggested IV cannula and also diuretic administration. So we need to reassure the patient regarding all this. Now the fourth one, community healthcare center, that was the setting. Patient with unknown case, patient is concerned about DPT vaccine, about the need, the side effect of that. So we need to explain well about the DBT vaccine, the need of that, where it will be available, which means it available in school health and community health center, proper health education to the patient, and also we need to reassure. Okay, now about the fifth one, advise and ensure the patient who planned for transesophageal echogram. We need to explain the procedure to the patient, the need for that, and also we need to reassure the patient. Next card, sixth one, talking to a patient after the examination. We already completed the examination, so we don't want any introduction. Patient is noted with hypotension, so we need to advise and reassure the patient the need to consult a general practitioner. Okay, so that's about the 6 different role play card. Now, about the listening section, part 1, the conversation with a neurologist, and again the conversation with a dietitian. Second part with the conversation with the neurologist and conversation with a rheumatologist. Listening went good. So try to practice for all the sections in an equal mode, and all the very best for your results. Comment your experience.